When you think about protecting your brain from Alzheimer's disease, what comes to mind? Sleep, supplements, exercise, diet, social connection. The 27 mechanisms we've covered in this series, I'm willing to bet that your mouth does not come to mind. And that is one of the most consequential blind spots in modern brain health awareness. Because what a landmark study published in the journal Science Advances has established about the connection between your oral health and your brain health is extraordinary in its specificity and its implications. The researchers examined brain tissue from Alzheimer's disease patients and from healthy controls. They were looking for something specific, the genetic fingerprint of a bacterium called Porphyromonas gingivalis, the primary bacterial driver of chronic gum disease, a bacterium that is supposed to live in the mouth, nowhere near the brain. They found it in the brain tissue of Alzheimer's patients at dramatically higher concentrations than in healthy controls. Not occasionally, consistently. The bacterium and its toxic products were present in the vast majority of Alzheimer's brain samples examined. And, most significantly, the researchers found that the bacterial presence correlated with the severity of the pathological hallmarks of Alzheimer's disease. More Porphyromonas gingivalis, more tau tangles, more neuroinflammation, more neuronal death. This was not a peripheral finding. This was not an incidental observation. This was a rigorously documented, mechanistically explained demonstration that the bacterium responsible for chronic gum disease, a condition affecting approximately 70% of adults over 50, is contributing directly to the brain pathology of Alzheimer's disease. And the mechanism through which it does so, a family of toxic enzymes called gingipains, is now one of the most actively studied targets. A pharmaceutical company called Cortexime has been developing a gingipain inhibitor specifically targeting this mechanism. And the interest from the pharmaceutical industry reflects the seriousness with which the research community now regards the connection. By the end of this video, you are going to understand exactly how your oral bacteria are affecting your brain. And you're going to have a comprehensive, Harvard-informed oral health protocol that addresses this hidden driver starting tonight. Let's understand P. gingivalis, what it is, how it lives in the mouth, and what makes it so specifically dangerous to brain health. Porphyromonas. Gingivalis is a gram-negative anaerobic bacterium. It thrives in the oxygen-depleted environment of the periodontal pocket. In a healthy mouth with good oral hygiene, P. gingivalis is present in small, controlled quantities as part of the normal oral microbiome. The immune system keeps it in check. Brushing and flossing prevents the accumulation of the anaerobic conditions it requires to proliferate. When oral hygiene is inadequate, as it is in the majority of adults over 50 who do not floss regularly, who have gum recession or existing periodontal disease, P. gingivalis establishes itself in significant quantities in the periodontal pocket. In large quantities, it produces a suite of virulence factors that are among the most tissue destructive produced by any commensal oral bacterium. The most important of these factors, and the ones most directly relevant to brain health, are the gingipains. Gingipains are a family of cysteine proteases, enzymes that cleave proteins at specific amino acid sequences, produced in large quantities by P. gingivalis. There are three primary gingipains: arg gingipain A, arg gingipain B, and Lis gingipain, named for the amino acid sequences at which they preferentially cleave. Gingipains serve P. gingivalis as nutrients. They cleave host proteins into peptides that the bacterium uses as amino acid sources. But their destructive effects on host tissue are far broader. Gingipains cleave and inactivate complement proteins, part of the innate immune system. They cleave cytokine receptors, disrupting immune signaling. They cleave the proteins that maintain gum tissue integrity, driving tissue destruction. And they cleave the proteins that maintain the blood vessel walls, contributing to the bacteremia that allows P. gingivalis to enter the bloodstream. The bacteremia, the presence of P. gingivalis in the circulation, is the bridge between your mouth and your brain. Every time you chew food, brush your teeth with already inflamed gums, or undergo dental procedures, P. gingivalis can enter the bloodstream transiently. In most people, this bacteremia is brief, but in adults with established periodontal disease, particularly those with aging immune systems, it is more sustained. And once P. gingivalis is in the bloodstream, it has the biological machinery to cross the blood-brain barrier. Research documented that P. gingivalis crosses the blood-brain barrier through multiple mechanisms, including direct migration through endothelial cells. Once inside brain tissue, P. gingivalis establishes a persistent infection in neurons and in brain endothelial cells. Protected from immune clearance by its sophisticated evasion strategies, it continues producing gingipains inside the brain itself. Now let's trace the specific pathways through which P. gingivalis and its gingipains damage brain tissue. The mechanisms are specific, well-characterized, and directly connect to the Alzheimer's pathology we've been working to prevent throughout this series. The first and most directly documented mechanism is gingipain-mediated tau cleavage and aggregation. Tau protein is directly cleaved by gingipains at specific sites that promote its abnormal aggregation into neurofibrillary tangles. Research and science advances found that gingipain exposure to tau produced fragmentation patterns remarkably similar to those seen in Alzheimer's brain tissue. These cleaved fragments serve as seeds for tau pathology, initiating a cascade that spreads progressively through connected neural circuits. This provides a bacterial origin for tau pathology, acting as a significant contributing mechanism in the brains of people with periodontal disease. It connects to the exosome-mediated tau spreading mechanism, where we established that tau propagates partly through exosomal transfer. P, gingivalis cleaved tau, may be particularly prone to exosomal packaging, a gingipain exosome pathway that the latest research is beginning to document. The second mechanism is neuroinflammation through NF-kappa B activation and IL-1 beta and TNF alpha production. P. gingivalis, LP-cis, is produced in large quantities in the periodontal pocket and released into the circulation during bacteremia. When it reaches the brain, it activates microglia through TLR4 receptors and drives NF-kappa B-mediated neuroinflammation. P. gingivalis neuroinflammation is not limited to its LPS. Gingipains themselves are potent activators of the complement system and the inflammasome, particularly the NLRP3 inflammasome, which drives IL-1 beta production and pyroptotic cell death. Gingipain exposure produces inflammatory responses significantly more potent than P. gingivalis LPS alone, reflecting multiple parallel activation mechanisms. The third mechanism is amyloid beta production stimulation. Research found that P. gingivalis infection increases beta secretase in neurons. This increased production creates a synergistic acceleration of the two primary pathological hallmarks of Alzheimer's disease simultaneously. The fourth mechanism is mitochondrial damage. Gingipains have been shown to penetrate neuronal mitochondria and damage mitochondrial inner membrane proteins. This produces mitochondrial dysfunction and increased ROS generation that is characteristic of advanced Alzheimer's pathology. The fifth mechanism connects to blood-brain barrier vulnerability. P. gingivalis directly degrades the tight junction proteins of brain endothelial cells. Gingipain-mediated cleavage of occludin and claudin-5 degrades the structural proteins that maintain blood-brain barrier integrity. Every bacteremic episode creates a self-amplifying cycle where initial entry damages the barrier that prevents subsequent entry. Before we get to the protocol, let's understand why this problem is so widespread and why so many adults over 50 have oral burden. Periodontal disease, the gum infection driven primarily by P. gingivalis, is the most common chronic infection in humans. The Centers for Disease Control estimates that approximately 70% of adults over 65 have some degree of periodontal disease. Many of these cases are classified as mild to moderate, insufficient to cause obvious symptoms that would prompt medical attention. However, they are sufficient to maintain P. gingivalis populations that drive systemic inflammation and, over years, brain exposure to the bacterium. The reason periodontal disease is so underdiagnosed is because the early stages are asymptomatic. Bleeding gums during brushing, one of the earliest signs, is so common that most people have normalized it. Mild gum recession is often attributed to aging rather than recognized as pathological. The aging-specific factors that make periodontal disease more common after 50 are multiple. First, gum recession creates new anaerobic niches that P. gingivalis can exploit as the roots become exposed. Second, many medications commonly prescribed after 50 produce dry mouth as a side effect. Saliva is critical for oral defense. Reduced flow allows P. gingivalis proliferation. Third, immunosenescence. The aging immune system becomes less effective at controlling established bacterial infections. Against the senescent immune cells of aging, the bacterium's evasion is even more effective. Fourth, the accumulation of dental restorations like fillings and bridges create new surfaces where biofilm can accumulate. The same oral hygiene practices that worked at age 35 may be insufficient at age 65. The biological context has changed, requiring more comprehensive oral care strategies. The mouth-brain protection protocol has 4 components, and it is one of the most practical and most immediately implementable in this series. Because unlike the cellular and molecular mechanisms of previous videos, the oral health interventions are directly accessible and produce benefits that compound rapidly. Component 1, professional periodontal evaluation and treatment. This is the highest priority action for any adult over 50. If you have active periodontal disease, pockets deeper than 3 millimeters or bleeding, no amount of at-home care will adequately control bacteria. Professional treatment, including scaling and root planing, is the most direct intervention for reducing P. gingivalis burden in the oral cavity. Research has shown that successful periodontal treatment produces measurable reductions in systemic inflammatory markers including CRP, IL-6, and fibrinogen. The systemic anti-inflammatory benefit extends well beyond the mouth, with improvements in cardiovascular markers, blood glucose control, and cognitive function. The action: schedule a comprehensive periodontal evaluation with your dentist or periodontist. Request probing depth measurements. This is not optional for brain health. Component 2, daily mechanical disruption of the P. gingivalis biofilm. This bacteria lives in a structured community embedded in a protective matrix. Mechanical disruption, physical removal of the biofilm, is the most effective means of controlling it. 2 practices are most critical. The bass brushing technique, angling the brush at 45 degrees to the gum line, is significantly more effective than conventional scrubbing. Electric toothbrushes, particularly oscillating rotating types, have been shown to significantly outperform manual brushing for plaque removal. Component 3, oil pulling for suppression. Sesame oil pulling for 10 minutes daily significantly reduced P. gingivalis counts. Adding 2 to 3 drops of clove essential oil, which contains eugenol, produces significantly greater suppression than oil alone. The protocol: 1 tablespoon of oil with clove oil, swished for 3 to 5 minutes before brushing. Spit into a tissue. Do not swallow. Component 4, targeted nutritional support. First, CoQ10, specifically for gum tissue to reduce inflammation and bleeding. Second, vitamin C at 500 to 1,000 milligrams daily. Vitamin C is essential for collagen synthesis and repair in gingival tissue. Third, the oral probiotic Lactobacillus reuteri. Research shows significant reductions in bacterial counts using specific oral lozenges. The complete additions: Bass technique brushing, daily interdental cleaning, morning oil pulling, vitamin C, and oral probiotics before sleep. And remember to schedule your professional periodontal evaluation. This is a vital step in protecting your cognitive longevity. 28 videos, and with oral health and the mouth-brain connection, we have addressed what Harvard researchers describe as a direct causal pathway to Alzheimer's pathology. Let me show you how the oral health protocol connects to the full system we've built. First, P. gingivalis and neuroinflammation. Gingipains activate microglial signaling pathways, producing neuroinflammation. This adds to the gut LPS and mitochondrial stress we have already addressed in previous videos. Reducing oral P. gingivalis burden removes a direct bacterial source of brain inflammation. Both the protocol and anti-inflammatory compounds are necessary for comprehensive control. Next, P. gingivalis and tau pathology. Gingipain-mediated tau cleavage drives the same tangle formation that insulin resistance promotes through different mechanisms. The oral protocol reduces the tau cleavage pathway, providing a distinct protective mechanism alongside our brain insulin protocol. Furthermore, gingipains degrade tight junction proteins in the blood-brain barrier. This acts alongside arterial stiffness and EMF mechanisms we have previously addressed. The oral microbiome and gut are in constant communication. P. gingivalis swallowed with saliva reaches the gut, disrupting the delicate microbiome balance. Our precision probiotic protocol, including L. reuteri, protects the gut, while the oral protocol reduces the pathogen source at its origin. Eliminating any source of systemic inflammation makes every other intervention more effective. This protocol is reducing a direct source of bacterial inflammation reaching your brain. The system grows more complete with each addition. The oral health protocol is one of the most clinically urgent additions in the entire series. The mouth-brain research has not received the public attention it deserves. A causal mechanism linking chronic infection to neurodegeneration should be front-page news. You now have the information, and the protocol is simpler than almost anything else. Total daily investment, under 10 minutes, 3 to 5 minutes of oil pulling, 2 minutes of correct brushing, 1 minute of flossing, 1 oral probiotic lozenge before sleep. Here's your specific action plan. Purchase clove and coconut oil for oil pulling. Order BioGaia Prudentis lozenges. Add liposomal vitamin C. Schedule a periodontal evaluation and upgrade to an electric oscillating rotating toothbrush if you haven't already. Start these steps this week. Next week on neurovitality. After 50, we explore photobiomodulation, using specific wavelengths of red light to directly stimulate mitochondrial function in neurons. Clinical trials have documented cognitive improvements in adults. It is one of the most exciting frontier topics we have covered yet. Subscribe now and share this with someone whose health is at stake. Thank you for 28 videos. Stay sharp, stay clean, stay vital.